wonderful speaker we have with us today. Sandy, as you can see, is going to be recording this part. So without further ado, I'd like to welcome Lily and Kristen.
Thank you so much, Jennifer. And I wanted to ask real quick, I've not done Zoom recordings, many of them. Should I keep my camera on or off? I'm fine either way, but I don't want to disrupt whatever the recording is.
Keep yours on. You'll be
okay,
the only
perfect.
one. Yep.
Perfect. Thank you.
You're welcome.
Let me go ahead and see if I can get my screen shared here real quick. There we go. All right. Hopefully y'all can see that. And let me get it up on the screen. All right, there we go. Let me reduce my window there so I can just kind of see. There we go. I can actually see now. So my name is Lily Kristen. My pronouns are she, her, hers, and I'm a psychologist and associate professor at the Medical University of South Carolina. One of the most wonderful parts of my role and in my current position is I'm the mental health coordinator and psychologist for our pediatric and adult CF programs at MUSC. And I just absolutely love that part of my work. I want to thank you all so much today for having me here to talk a bit about dating and relationships for women with CF. And I'm going to go through and give let me see if I can advance. How do I advance? There we go. I told you I'm not a tech person, so thank you for your patience. So I want to cover a number of different things today, and I will go ahead and just say any one of these could be probably a whole talk in and of itself. So my goal is to do really kind of an overview rather than deep dive, and to really kind of think about starting some good conversations and ideas for y'all. I want to talk a bit about just relationships in general, but are also particularly those of the romantic nature. Also dating and disclosure about having CF, and also kind of the whens and the hows, and some ideas about how to make those disclosures. I also want to talk a bit about fostering and growing self-love and appreciation for your whole self as you date and build relationships. So, this relationship with yourself is really a foundation for building other high quality relationships. And I want to just also talk a little bit about some complex aspects of relationships with CF. So some, it can be really hard to navigate balancing this idea of asking for help from partners and also grappling with sometimes negative thoughts about feeling like a burden. And I also want to talk a little bit about how to manage CF symptoms in the context of sexual intimacy, because that's an important part of relationships. The last part I want to chat about today is a little bit about getting committed. So some logistics around commitment and managing some of the fears around commitment logistics, ranging from benefits, disability, family building, and becoming a parent. And again, I acknowledge any one of these could probably be a talk on it in and of itself. I want to do a quick word on relationship diversity as well. I'm here to talk about women with CF, but it's really important to acknowledge that women with CF identify with diverse sexual orientations and gender identities. And a quick word about terminology. I'm going to use the term women to encompass all of those who identify as women with CF, and I'll aim to use significant other, partner, spouse, married person, et cetera, to really include the range of romantic relationships for women with CF. Though sometimes if I'm given a specific example, I might use a more specific term like boyfriend or something more along those lines. So it's important to remember relationships really matter to our overall health and wellness, and especially romantic relationships. And research over time has shown, time and time again, that positive and supportive, happy relationships are associated with lower morbidity and mortality. And I really want to emphasize that relationship quality and the happy part matters. So being satisfied with the relationship, not just simply having the relationship. And for people with CF, from the research, we know that better social support in general is associated with decreased treatment burden, improved physical and mental health, quality of life, vitality, body image, and health perception. And we know that receiving social support from romantic partners is one of the most important perceived aspects of a romantic relationship. So really getting that support. And in general, having a partner is significantly associated with better quality of life in adulthood. So we're kind of thinking about the bigger picture. not only on health indices, but also the day-to-day living. And there's some research that has suggested that social support may be even more important to women than men with CF. And so this is really an important topic for women with CF. I wanted to share some of the current data from the most recent cystic fibrosis patient registry, the annual data report from 2020. And it's really kind of taken a step of looking at past 20 years in terms of relationships. And for about 45% of people in 2020, people with CF are married or living with a significant other. And these rates are really steadily increasing over the past 20 years. So have really tripled over the past 20 years, which is great to see. Alongside those changes, we also know from this data that rates of pregnancy in women with CF are also increasing. And the pregnancy rate among women with CF has kind of remained relatively constant between 2000 to 2019, and then really a marked increase in 2020, some may say due to some of the new interventions available, including modulators. And this is really actually, just to highlight, this is in contrast with the general US population, which actually had a decline in pregnancies during that same time in 2020. So all to say, dating, relationships, commitment, family building, all of these topics are so important and current for women with CF. So, early in relationships and dating, women with CF may sometimes hold back and wait to share or disclose that they have CF until the time seems right. And that idea of seeming right is a very personal decision. Thinking about sharing I have CF with a potential or current significant other can really bring up a lot of questions. I really like this particular blog post was by a woman named Emily with CF. And she really outlined some of the key questions that women often grapple with. Can I trust this person? What do I tell them? How will they react? Will they be grossed out by my symptoms? Will they be scared? And ultimately, will they stay if things get hard? And, I think it can feel scary and difficult to have this conversation, particularly when you're first setting out to do so. So I want to share some of the research that has been conducted on dating and disclosure about having CF, which has some really useful points to consider when you're in this situation. So first of all, I want to introduce the idea of communication privacy management theory. It's a kind of a dry name, but has some really great nuggets. And this theory really posits that disclosing information to anybody can really make us vulnerable. So opening up can make us vulnerable. And the real flip side to that is that actually sharing private information can lead to better coping and can really help us to grow and foster relationship closeness with others. And so basically vulnerability is not a bad thing. It can open up doors to connection, but we also don't share everything about ourselves with everybody we meet, and sharing information can also make us vulnerable. So this theory, Petronio et al. Is the one who put this out. It really asserted that people make decisions about sharing their private information with a few main principles in mind. And so for each person, it's a really complex calculation about kind of an assessment, if you will, of when and how they will disclose this information. And so I want to talk through these because I think there's some really helpful points there. So one is privacy ownership, and a person really you may take into account like how the amount of about your CF you've already shared. In privacy ownership, we really think that like we as human beings really believe we own our personal information, and we want to be able to only allow access to that information with people that we may trust. We own it, it's ours. This is actually a really interesting idea because people have different levels of privacy ownership or kind of comfort with what they've shared so far. So, some people have a much more public face around their experience, whereas others are much more private and don't share with many people. And so, for instance, a person may really take into account how much they're also sharing already. So if you've already disclosed, for instance, that you might have CF on a social media website or something like that, it's in a more public forum than perhaps only discussing with friends and family. Another thing that is important to consider is that we really do believe that we have privacy control. So we really have a desire to, and we want to maintain control over our personal information. Sometimes there are breaches around that, and that can feel really uncomfortable. We don't like when others share our information. And we really feel more comfortable when we have the control over the when and the how to do things in terms of sharing. the last concept here, privacy turbulence, or they may also call it coordinating collective boundaries. This really means, when multiple people are aware of information about you. So for instance, that you have CF, you share collective boundaries around that information, which means that actually sharing with people about what you're comfortable with is an important part of disclosing. The other person may have the potential to violate rules of privacy. And so communication around your boundaries is really important. And there could be a whole talk on assertiveness and boundary setting. It's a really important thing. I'm actually very passionate about myself. And, I think it's suffice to say for here that making those boundaries and coordinating collective boundaries is a really complex and personal process. So disclosing a CF diagnosis to a potential romantic partner really involves weighing the risks and the benefits of sharing CF-related information. I can't emphasize enough, this is very individual and relationship specific. If there is a perceived risk of like a negative reaction, or there's other clues that might be the case, a person may really choose to hold off and really hold that boundary for a bit longer, or at least pause until more data is gathered. And that's very important to kind of listen to your own kind of perspectives and your own personal values around that. There has been some work that has really suggested, Brookema and Weber did this really nice study that shows that, privacy rules for people with CF really change over time, and that shifting those rules is okay. Absolutely. It's kind of what happens sometimes, especially it can be triggered at times by changes in health, for instance. So folks with CF may decide, now my disease is getting worse, or I'm in the hospital. And so now is the time that I need to share this. Whereas other folks really may choose to share when they're ready to test the waters, kind of seeing how is this person going to respond to this important information? This is part of who I am. And so I want them to be able to accept me for this. So let's see how this goes, to see if the person will kind of stick with them through both good times and the bad. And, I think another powerful motivator for sharing is often that seeking connection. So with the desire, sharing this information, getting some social support around managing a disease, or, any other of the complex other aspects of living with CF, that social support can really help with disease management. And I think it's important, though, again, there are no rules or guidelines to this. It's really your rules are your own. Every person, has their own boundaries and kind of feelings, if you will, about what they're comfortable with. And your rules are your own. They're shaped by your own past experiences, your own kind of experiences with boundary setting, not only about disclosing CF, but also your other aspects of your relationships. And there's actually some really important research that has shown that past disclosure experiences, so people who have shared information about their CF with others who haven't gotten very positive reactions, that may really affect, to as outsiders, so people who are not directly in the dyad, but that may actually, those negative experiences may really affect how willing someone is to then proceed to share. And so I think I can't emphasize enough how much important it is to reflect on personal boundaries with this. I really like this concept of sharing authentically with boundaries around this and many other things in relationships. So your assessment is all of when to share is yours, and it's really most important to know yourself and where you stand on sharing. And one suggestion from the research is that really determining what you need in your relationships, what your values are, looking for the response of an attentive and active listener by partners. Research has shown that when that is happening, when discussing stressful things or even disclosing CF diagnoses, that's associated with better dyadic coping. So coping together as a dyad, and also satisfaction in that relationship. So, you get to determine what you need in relationships and what your values are. And it's really helpful to kind of be on the lookout for those signs of mutual empathy, this active listening, division of the roles, even kind of helping out with care, and really good, open, direct communication. So if you decide to share, another suggestion from the research is that, kind of thinking about when and how, it may actually really be helpful to allow your partner to develop his or her own relationship with CF. And so one study identified that for folks who had disclosed, they felt like demonstrating versus explaining to CF to partners really enhanced understanding. So showing versus telling, bringing the person with you to see what experiences you have to go through day to day, go into clinic, for instance. Some of that demonstration really helped versus just describing it verbally. And so ultimately, vulnerability can be a really good thing, but it's also important to protect yourself and, share. This is really kind of coming back to this idea of sharing authentically, but with boundaries. So I want to read this quote. I like it because it ties a bit into this past topic of disclosure, but also a good transition to the next one I want to chat through. And I'll read it aloud here. So this is Brene Brown from Gifts of Imperfection. Love is not something we give or get. It is something that we nurture and grow. A connection that can only be cultivated between two people when it exists within each one of them. We can only love others as much as we love ourselves. And so I want to talk a little bit now about self-esteem and body image, that identity when living with CF symptoms. And also really, it's so important to think about as we think about relationships, but also fostering and growing your own self-love, loving yourself first as you build those relationships. How we feel about ourselves, knowing our own values has implications for dating. I think sometimes disruption in body image and just our self-esteem overall can really lead to feelings of shame or guilt, isolation, feeling stigmatized. And that really kind of those are emotions that sometimes drive us away from others and really can be a wedge between ourselves and others. Whereas, really being loving towards ourselves, body and mind, can really enhance closeness. And so body image itself refers to perspectives and thoughts that we have about our body shapes and features that affect our lived experiences, our mental health, and how we take care of ourselves. I want to just highlight some of the great resources at CFresh. There's a whole section with some really great conversation guides and other talking points, things to consider around body image at that link. So I think it's a really great resource that's there. And I want to highlight too that our image of ourselves, our self-esteem, is not only affected by weight or size, which is I think oftentimes what people most commonly think of when they think of body image. But there's a lot of other aspects of living with CF that can affect body image and self-esteem. One is, this idea of being in a patient role. So having to be constantly having your mind focusing on that versus some of the other stuff of daily living, managing symptoms that are not weight related, but other complicated symptoms. For instance, coughing up sputum, that's not fun for anyone. And, there's also, quite a bit of, both societal pressure, sometimes familial too, in our culture around, how, our identities around being able to go to school and work, our perceptions of contributions, our productivity. And a lot of that stigma does stem from society. And I think I just want to comment that stigma is there and present. It deserves to be acknowledged, but no one of us, you all included, we are all so much more than our bodies and what we do. Our society does place emphasis on productivity, for instance, but it's not the one true story and about ourselves and our worth. I really love this quote. It's an article from The Body Is Not an Apology, which has a lot of great resources about radical self-acceptance, particularly around different issues related to the different things that are stigmatized in our society, including chronic illness. And this quote is, in this life, your purpose is not dependent upon your productivity, on how much labor you can perform. You do not have to be useful. You do not exist to be used. Your life is of purpose because it's yours. That's by Gillian Giles. And I think fostering and growing self-love as you date and build relationships, those things have to kind of happen hand in hand. It's part of, growing those deep relationships is that relationship with yourself. And so some small reminders here really kind of working to practice loving and appreciating your authentic self, the way you are. The infiniteness of you is so much more than the outside or what you're able to do on any given day. I think it's really important to practice starting to notice internal narratives about ourselves and where it comes from. Is it reflecting our inner critic? Is it society standards? And also starting to challenge or reframe by putting focus on what you value, not necessarily what you're told to do. Really also focusing on what your mind and body can do and what your personal values for living are. That's, I think a lot of times it's easy to focus on what we can't do. And there's such a flip side to that of all the beautiful things our bodies are able to do, and our minds, and our spirits. So I think it's really a valuable exercise to reflect and learn our own personal patterns and triggers for feeling less than. And also on the flip side, the patterns and routines that help us feel like our best selves, and really trying to enhance those and integrate those day to day. Connection in terms of growing our self-love is so important. Connecting with other people with CF who may be having similar experiences, really in safe spaces, is really valuable. And also contributing back and connecting by sharing what you've learned with others. That's another really wonderful way to foster self-love and self-esteem. So I want to highlight too, this last one. I'll talk a little bit more about what this means exactly in the next slide, but practicing tender and fierce self-compassion. Self-compassion, when we're doing this, we're giving ourselves the same kindness and care and love that we'd give to a good friend. We're accepting ourselves here in this moment with our imperfections, kind of the whole picture. And I love this graphic. It's by Kristen Neff. She's a psychologist who's really devoted her career to the scientific study of self-compassion. And this is a lovely way to kind of distill down this more complex topic into a really nice way. So this idea of self-compassion having both tender and fierce sides can be likened to a comforting parent mama bear and a fierce mama bear. And so, when we're building relationships, these two parts of ourselves are important to have represented and to continue to foster. So tender self-compassion here really means that we're being kind to ourselves at the core. We're loving towards ourselves. We are present with our suffering in a very tender way, acknowledging it. Is very, very similar to like a parent comforting an upset child, kind of just being there and listening. On the other side here, another side of self-compassion is also taking action to alleviate suffering. This may be protecting, it may be providing and saying providing kind of a concrete assertions of what our needs are. It may be motivating and doing advocacy to change the world, change our conditions. And I think a huge part of this that is really pertinent to relationships is sometimes part of that fierce self-compassion is setting boundaries in relationships and really saying yes to our own needs and expressing what they are. So really taking action more closely to a mama bear, if you will, a fierce mama bear. And we all have these forces within us and the potential to kind of like harness and really foster these areas. And doing that, really helps to set the stage for healthy relationships. So even when practicing self-compassion, it can be hard to pull off the mask and be very real and vulnerable in expressing our needs. I want to acknowledge it's really, that's such a challenging thing for everybody. We have a hard time as humans, asking for help, and we often feel like a burden. But I really want to emphasize, this idea of self-compassion really is that, part of that self-love and part of being in a genuine member in a relationship is making requests without guilt and speaking up for what you need. So being assertive about what you need, and what you need in order to feel supported, and also, speaking up about what makes sense for you, allowing partners to participate in aspects of daily management of your disease. That's something that is absolutely okay to do, and that self-advocacy is an important part of that self-compassion. I also think, setting those boundaries is important, and just to acknowledge, if a partner does respond poorly, is not supportive when you do ask for help, that's sometimes an indicator of some relationship health concerns. And so sometimes other supports or interventions, sometimes couples counseling, or even just having a discussion around it is an important direction to make sure that that relationship continues to stay healthy and that you have the support that you need. So we wouldn't be able to do a talk on dating and relationships without talking a little bit about sex. I think sexual intimacy, is such an important component of healthy relationships. Indeed, I think anyone who does any work in couples therapy or counseling, has read and is, the Gottman duo. They're a married couple who does research on relationships. John and Julie Gottman really speak to the fact that affection, close physical intimacy, good sex, relationship, kind of romantic romance in the relationship, passion. These are all really important components of healthy and positive relationships. And so one of the things, is we know that from some of the research that's been done more recently is that many women with CF, have some things that may interfere with some of those moments of sexual intimacy. People with CF have sex just like everybody else, and that's very normal, and it's encouraged. It's a wonderful part of being a human. And so I think, what I hope to kind of highlight here is that, while some of the things that may happen during sex may cause some unpleasant symptoms, there are, communication is something that's really important in these contexts with your partner. So, we know when folks are having sex, they have an increase in heart rate and respiratory rate that can sometimes trigger unpleasant symptoms like shortness of breath or cough. For some people, even hemoptysis. And so Kazmersky and her colleagues, Tracy Kazmersky, has really devoted a lot of work recently to understanding these concerns in women with CF, and reported that about 16% of women with CF report sexual functioning concerns, and about 33% report cough during or following sex. So it's something that's really happening. And so, sex is such an important part of relationship wellness. And so communicating about what things that may help sexual intimacy to be more enjoyable in the context of those symptoms is important. And so there's a really great article recently, Jane et al. In 2001, that I draw some of these from, but these are also things like each person can kind of think about for themselves, what helps them, really some strategies for helping to make sexual intimacy a more comfortable experience as it pertains to CF symptoms. So that may range from doing airway clearance before having sex, to suggesting adjusted positioning, or using pillows, or prompting, propping yourself up in certain ways. And, even doing things like pursed lip breathing, some of the breathing exercises that may be used in other times, like those may be really beneficial to implement in that context. And so I think, again, key here is that you're having a relationship here. So it's also about communicating. And if something is uncomfortable or difficult, speaking up with a partner and helping, walking through and problem solving that with them. I also want to emphasize that, I think one of the things research has shown that actually, while women with CF have sex lives similar to all other women, in terms of sexual activity, they report really significantly lower rates of lifetime contraception use and STI protection. And so, about 20% less than the general population. So I think, that's a really important thing to be also communicating with your partner around. And, these are certainly important practices, but are often underutilized. So communication really matters around that as well. I want to read this quote real quick here, and I think it's really a lovely transition tying together some of these themes we've talked about today thus far. And it's from a woman named April Biggs, who is an adult with CF. You can see her there with her wife. I've always been ashamed about the more grotesque aspects of CF, the mucus, the smelly gas in bowels, the struggle to breathe in my sleep, the nebulizer treatments. Yet in that moment, I learned that I deserve good people who can sit beside me during the ugly parts of being a person with CF. Until I really started to know my own worth, not just the burden I bring as a person with chronic illness, I was not truly available to the right people. I believe we can't give others what we have not been able to give, or at least started to give, to ourselves. This one step took many years of excavating my emotions, my baggage, and my feelings of worthlessness as someone who is sick. It doesn't take everyone this long, and it takes some longer, but if you're in that place, know it is possible. And so this really ties together, again, this idea of really that relationship with yourself, but also ties into something I want to mention next, which is really coping communally together with chronic illness. And when I say coping communally, I mean, again, just coping as a dyad, coping together with a partner around many, many different aspects of chronic illness. And there's a really good literature suggesting that this does foster resilience, individual resilience, but also partner resilience. And dyadic coping, what it refers to is how each person responds to the stress signals of the other, and how partners can interact with each other while dealing with stressful situations that may come up around CF, for instance, here. And how individuals in romantic relationships cope with health challenges, if they either take the separate view, like you're dealing with this, versus the together view, which is we're dealing with this, really impacts both the individual well-being of the person and then also relationship well-being. Relationships are healthier when there's a we, especially around some key and core aspects. I think things to look out for, and then research also suggests that this is a really positive indicator for that dyadic coping communally. Active listening, sharing optimism, sharing hope and reassurance. Those are all really helpful in terms of the individual coping process coming from a romantic partner. And also fostering daily, I love this term, mundane, positive moments. So, and I mean by this, not the big stuff of relationships, but the little stuff, the mundane stuff. That's something, playfulness, humor, just those small moments, making coffee for one another. That can also, those small things, while they may seem small, when really gathered together, set the stage for wonderful emotional connections and positive dyadic coping. So being together in it. And it's also worthwhile looking for a relationship partner and a relationship that reflects this. It's a really worthwhile pursuit. So I want to spend my last few minutes here chatting briefly about a few thoughts about long-term commitments and some of the fears that can occur around getting married or building a family. I think a number of people with CF really fear that there's some consequences for getting married just based on their own personal situations about the commitment logistics, like the things that have to happen if one legally gets married. There can be an impact on disability, SSI. Federal rules have some, it may make, there may be really complicated scenarios that arise. And it may feel almost like getting married and having, a good healthcare. They may make those two things seem incompatible for some, which is a really, really tough situation to be in. Sometimes having or anticipating a disability may make marriage seem unattainable, and that's really frustrating. It shouldn't be that way. And, some of these guidelines and rules, I want to say it's one, you're not alone in experiencing this if you are, but also that it's very much a situation where there's not one right answer. I think it's so important. There's not a one size fits all response to these concerns. And it's so important for each partner, each dyad, each person and their partner to really to communicate about these concerns, especially as it pertains to healthcare benefits and finances. It's a really important conversation to have as things get more serious. And I also think it's so important. I'm definitely not a lawyer and can't really advise at all in that direction, but one thing I often do is I just really encourage folks to empower themselves with information and also good knowledge in this area. And by doing that with some of the expert resources, CF Legal, other legal advisors, to really help kind of look at one's personal situation. I think one of the things that we know is that pregnancy rates are increasing among women with CF, and about 80% of adolescents and women with CF would like to have children in the future. This is something that's really important and to many, and though not all, of course. And we do know that there's been some really good research recently focusing on this, that having CF is a consideration for many women around reproductive decision making. Women are sometimes really juggling a lot of different things and making this decision with their partners, ranging from the safety of it for themselves to balancing just the roles of a patient, being a parent, what to do with health progression. One qualitative work had this quote of just feeling of being a parent on compressed time and kind of what that means for both a partnership that and also the child from the family building. And women may sometimes feel like their CF isn't in their control. And sometimes when that's happening, when your body is doing things that you don't want it to be doing, that can really put a strain sometimes on parenthood, pregnancy decision making. And so I just want to acknowledge the challenges here. This is such an individual situation. There is no one size fits all response on how to handle this. But I think, each person's health and personal wishes should be taken into account. And each person's medical team is a great first source of support. I think that's an important role for CF care teams is to help foster and promote a healthy experience with family planning. There are some great resources already on CFresh that really kind of cover some of these nuances and things to consider. So there's a ton on this slide. I probably, just too much to even read through really, but I wanted to just kind of acknowledge other places to get support and information on this topic. Obviously CFresh, you all are familiar with, and the CF Foundation has some wonderful resources for especially things related to disability or financial concerns. CF Legal and CF Compass are really, really wonderful resources. I also want to encourage folks to really talk to their CF teams about any of the things we've talked about today or other things that pertain to relationships, if it's of concern, ranging from body image concerns, thinking about the team members who are suited to that, talking about sexual and reproductive health. I think a growing trend in CF centers is having immediate access to genetic counselors. We have one on our team who is invaluable, and we actually have sexual and reproductive health conversations as standard in both of our pediatric and our adult clinics. I also, I think a lot of times when there are stressors in relationships, sometimes having an outside lens can be helpful. So, bringing up those concerns to your mental health coordinator, the social worker on the team, and sometimes requesting even referral for counseling or therapy for those concerns may be a really great support. I think there are also kind of formal education programs. There are, so many self-learning resources out there. I have some here. One of my favorites that I'll just note is the Small Things Often podcast. It's put up by the Gottman Group. I don't think it's him specifically speaking, but it's it's a very short podcast. So it's like a couple minutes meaning, and they put out them regularly. And it's the whole idea is small things, very short tidbits that you can do in your daily relationships with your partner to kind of enhance that relationship. And it's this idea of those small mundane moments really making a big impact over time. So I know I'm probably at or over my time here. So I just wanted to note in closing here, relationships really, really do matter. I think coming back to this principle of sharing authentically with your partner with those boundaries, practicing self-compassion around your health and your body, all of those things set the stage for really healthy and positive dating relationships, and setting boundaries about things, when it doesn't feel like that's the case. I want, all folks with CF to know that, women with CF absolutely deserve healthy, supportive, caring, and long-term dating and longer-term relationships. That's something that is such an important part of health. And it's absolutely something that, should be a focus for our care teams and helping to support folks along those endeavors. And, not only the teams, but also other organizations. There's a lot of great resources out there. And like I said, there's probably too much on the slides to see, but I'm happy to email any of those resources to folks on request. And I guess I'll pause there. I know that's a kind of a rapid fire through a lot of the key aspects of dating and relationships, and there's so much more I didn't get to cover. But I hope I was able to spark some good conversation for today. And thank you so much for having me. I'm
Thank you
happy to
s-
answer any questions.